Stem cells are mostly found in the bone marrow. These stem cells are not embryonic stem cells, but are rather known as hematopoietic stem cells. These hematopoietic stem cells are able to differentiate into blood cells, such as red blood cells, white blood cells, and immune system cells. In the case of disease, hematopoietic stem cells are able to cure heart diseases such as heart attacks and blood disorders such as leukemia. When a woman is pregnant, there is a tube-like structure known as the umbilical cord, which connects the mother to the fetus. It is the umbilical cord that provides the life support for the child, including its nourishment and blood supply. After the baby is delivered, the umbilical cord is usually clamped, cut, and discarded. Scientists have recently reported retrieval of stem cells from the umbilical cord blood. In the photo, you see a blood collection pouch containing cord blood that is enriched with stem cells. This pouch will be sent to a bank for further processing and storage. Currently, many national and global umbilical cord blood banks store these stem cells. When you donate stem cells to a public bank, the stem cells will be accessible to anyone. When you store your stem cells in a private bank, you keep the stem cells for family or own use. In terms of compatibility, the percentage of finding a match for transplant is up to 90% in a public bank. If stem cells are stored in a private bank, there is a 100% assurance that it will be compatible with the child of the mother. There is about a 25% probability that the stem cells will be compatible with anyone else in the family. The probability that you will need a stem cell transplant using your own cord blood is 0.0005 to 0.04%. It does not cost money to donate to a public bank. However, for storage in a private bank, it costs $1,000 to $2,000 to begin banking and $100 to $200 annually. The costs to retrieve stem cells from a public bank are generally covered by insurance. It does not cost money to retrieve stem cells from a private bank.